Hello everyone, welcome to Pharma Icon, and the today's topic is about the explanation of pathophysiology. Here the first unit is in the pathophysiology. First of all, what is pathophysiology? Here pathophysiology is nothing but it is a type of study about the diseases along with their symptoms, treatment and their prevention. Okay, how many types of diseases are mostly occurs the body conditions are mainly physical, biochemical and mechanical. These functions are disturbed in the body, so that is called as a pathophysiology. So the unit 1 in pathophysiology is mostly includes the what are the topics in unit 1 are basic principles of cell injury. So these are the topics to be discussed. The first one is a basic principles of cell injury. What is cell injury? Cell injury means it is a type of injury which is occurs to the cells when mostly excessive stress conditions. So mostly stress is applied onto the cells that leads to the injury. Okay, injury means damage to the cells, so the cells may be adapted to the changes. So this is about the first topic. And what are the basic principles to be involved in the cell injury? And what is adaptation? Adaptation is a process in which it can be eliminate the cell injury. Adaptation can be eliminate the cell injury. Next, the basic principles involved in the cell injury are, first of all, the cell injury can be of two types: reversible cell injury and irreversible. The reversible can be leads to the adaptation, whereas irreversible cell injury can be leads to the death of the cells. And the second principle is the cells can be adapted to the injury. Okay. Next, the third one is cells can be responded to the stress. If any mechanical stress is applied onto the cells, they can be easily responded. And the fourth one is inflammation is a reaction to the cell injury. Inflammation also one type of a cell injury. And next, hypoxia. Hypoxia can also be leads to the cell injury. And next, adaptation. Adaptation can be also leads to the cell injury. Next, what is homeostasis? In this unit we will be discuss about the introduction to the homeostasis and definition of the homeostasis along with the components and types of feedback systems. First of all, what is homeostasis? Homeostasis is a type of body's balance condition between the physiological systems in the body. That is balancing of the body's movements to survive and function properly is called as a homeostasis. What are the components of homeostasis? The homeostasis mostly based on the types of feedback systems. What is a feedback system? The feedback system is a type of system which is act as a loop. Okay, and in that mostly it connects and controls the body data and responds to the particular system. Okay, and it also stables the internal body's environment. So that is called as a feedback system. How many types of feedback systems are there? There are positive type of feedback system and negative type of feedback system. Okay, next, the third topic is causes of cell injury and pathogenesis. What are the agents which are causes cellular injury? Okay, they are mostly many factors leads to the cell injury, like physical agents, infectious microbes and oxygen deficiency, some of the chemical agents, imbalance in the nutritional levels and immunological agents along with the freezing conditions. So these are mostly causes for the cell injury. And what is a pathogenesis of cell injury? The pathogenesis, it may be depends upon the types of cell and how much it will be affect the injury and what are the biochemical process to be followed in the pathogenesis of the cell injury. And the next one is cell membrane damage. How the cell membrane can be damaged in the cell injury? The cells, when they are exposed to the chemical or electrical or the mechanical stimuli, okay, the membrane to be suspected to these types of stimuli, they may be leads to the damage of the cell membrane. And next, the cell membrane can be irreversible. Okay, next, mitochondrial damage. What is mitochondrial damage? The mitochondria of the cells may be damaged in the process of the cell division, and maybe it leads to the causes of cell injury, and these mitochondrial damage can be disturbs the cell homeostasis. So this is about the mitochondrial damage. Next, what is a ribosome damage? The ribosome damage, it can also leads to the cell injury. If the ribosome is damaged, automatically it leads to the cell injury, and in which the damage of the ribosome can leads to the facility of the proteins translocation. The proteins may be translocated due to the ribosomal damage. And next, what is a nuclear damage? The nuclear damage that can be causes the three types of effects in the cells, that is pycnosis, karyohexis and karyolysis. What is pycnosis? It's a shrinkage of the nucleus, whereas karyohexis is a cell breakdown, and the third one, karyolysis. The karyolysis can also the cell nucleus damage. So this is about the cell membrane damage, mitochondrial damage, ribosome damage and the nuclear damage. All these four types can be leads to the cell injury. And next, what is the morphology of cell injury? First of all, what is morphology? The morphology, it is a type in which the changes, we can be determine the changes in the shape and structure of the organism. Okay, the morphology of cell injury. The cell injury can be detected by the number of morphological changes. First of all, necrosis. Necrosis means it is a type of cell death. And the next one is organelles dislocation. Due to the cell injury, some of the organelles may be dislocated. The organelles like mitochondria, ribosome, endoplasmic reticulum, smooth endoplasmic reticulum, etc. And next, what is adaptive changes? Due to the morphology of cell injury, some of the changes may be occurred in the cells. First of all, what is atrophy? Atrophy means it is a condition where declines in the body's organs or tissues. Next, what is hypertrophy? Hypertrophy, it is a condition in which the organs are developed in excess. Hyper means excess. And what is hyperplasia? The hyperplasia means cell production is increased. Okay, production of the cells is increased. What is metaplasia? Metaplasia is a normal condition in which replacement of the mature cells. Okay, next, what is dysplasia? The dysplasia means the abnormal development of the tissue. Okay, the cells may be developed in the abnormal levels. Next, what is cell swelling? The cell swelling is mostly due to the different types of environmental conditions, like water is interrupted into that, or other any substances which are entering into the cell may leads to the cell swelling. What is intracellular accumulation? The intracellular accumulation is mostly due to the presence of the excessive amounts, they may be enter into the intracellular membranes. So it also leads to the cell injury. Next, what is calcification? Calcification means it is a formation of the calcium. Okay, what are the calcium elements to be involved for their formation? Okay, the calcium is built up in the body, it leads to the hardening of the tissues. Okay, calcium is built up in the cells, it leads to the hardening. Due to the calcium, the tissues will be hardened. Next, what is enzyme leakage? The some types of leakage is occurred from the different types of the enzymes, and it's lead to the cell death. What is cell death? Cell death is a biological process where the cells are stops all its functions. Okay, next, what is acidosis and alkalosis? The acidosis and alkalosis occurs when the body is unable to maintenance of the acids and alkalosis levels, that is disturbances of the acid base balances in the body. Okay, next, electrolyte imbalance. What are electrolytes? Electrolytes are mostly sodium, chloride, phosphates, sulfates, etc. These electrolytes imbalances, when they occur, the electrolyte imbalance is mostly occurred when the conditions like dehydration and overhydration and other medications they may be used. Okay, this is some of the important topics in the first unit. And the next topics in the first unit are, what are the basic mechanisms involved in the process of inflammation and repair. Okay, the first one, the mechanism involved in the process of inflammation are, inflammation is a type of protective response, okay, and which is heals the damaged area is called as a repair. Okay, where the system, inflammatory system mostly repairs the damaged area. Okay, next, what are the clinical signs of inflammation? Introduction and clinical signs of inflammation. How many types of signs of inflammations are there? There are mostly 4 signs of inflammation. First one is redness, and after redness, heat and swelling, and the fourth one is a pain. These are the 4 signs of inflammation. Next, what are the different types of inflammation? There are only 2 types of inflammation. They are acute inflammation and chronic inflammation. Next, what is the mechanism of inflammation? The mechanism of inflammation is mostly of different types based on the how the cell injury may be occurred. Okay, next, what is a wound healing? Okay, wound healing procedure. Wound healing is a type of healing mechanism which is occurred in the body. They are mostly of due to the homeostasis, inflammation, fibrin clot, regeneration and reepithelialization. These are the different principles involved in the wound healing. Okay, next, what is the pathophysiology of atherosclerosis? First of all, what is atherosclerosis? Athero means arteries. Okay, the atherosclerosis is a disease which is mostly related to the heart, in which larger amounts of lipids, fibrous elements and calcium, they are mostly built up in the larger arteries, which is leads to the blockage of the arteries to pump the blood to the heart. Okay, this is about the atherosclerosis. Next, these are the unit 1 topics. The unit 1 is very lengthy but is more important. And the second unit is mostly deals with the cardiovascular system. What is cardiovascular system? The cardiovascular system means cardio. The word cardio is related to the heart. What is vascular? It is a pumping system. Vascles like vessels, arteries, veins, etc. Okay, first of all, hypertension. What is the hypertension? Hypertension is a condition of the heart in which the blood is too high. Blood pressure is too high. Okay, they are mostly 140 by 90 mmHg. In the hypertension, the systolic pressure is 140, whereas the diastolic pressure is 90 mmHg. Okay, and the second condition is a congestive heart failure. What is meaning of congestive heart failure? Congest, the heart area is very congested to pump the blood. Okay, which is a chronic condition in which the heart is unable to pump the blood. Okay, unable to pump the blood. Next, what is ischemic heart disease? The ischemic heart disease is mostly the heart muscles are damaged. Due to this, the reduction in the blood flow. Okay, this is called ischemic heart disease. In these are the ischemic heart diseases like angina, myocardial infarction, atherosclerosis and arteriosclerosis. Okay, these are the ischemic heart diseases. First of all, angina. Angina means what? Angina is a chest pain. Okay, why the chest pain is occur? Due to the heart is not enough to pump the blood. Okay, next, what is myocardial infarction? Myo means less. And the cardial, heart infraction. Myocardial infarction is a type of heart attack when the heart muscles are doesn't receive any oxygenated any oxygen or any blood. So that condition is called as a myocardial infarction. And what is atherosclerosis and arteriosclerosis? The atherosclerosis and arteriosclerosis are related to the arteries and the veins. Okay. Next, respiratory system. What is respiratory system? The respiratory system, which is mostly includes the process of respiration like expiration and inspiration, and deals with the capacity of the lungs. Okay. First of all, asthma. What is asthma? Asthma, it is a chronic lung disease in which the airways, they are very narrow and swell. Due to this, there will be a difficulty in the breathing. Okay. Next, the chronic obstructive airway diseases. How many types of chronic obstructive airway diseases are there? Due to these airway diseases, they are unable to breathing properly. Okay. Next, renal system. The renal system is mostly associated with the kidneys, functioning of the kidneys and nephrons. What are the system renal failures? How many types of renal failures are there? Acute renal failure and the chronic renal failure. The renal failure is mostly the condition in which the kidneys are unable to filter the water and other components in the body. Okay. This is about the renal failure. And the renal failure is mostly two types: acute renal failure and chronic renal failure. Next, the unit 3. The unit 3, the topics covered are: first one is hematological diseases. What are hematological diseases? Hematological diseases are mostly blood related diseases. Okay. First of all, iron deficiency. What is iron deficiency? Iron deficiency means the body is unable to give sufficient amount of iron for the supply of its needs. Okay. That is called iron deficiency. What is megaloblastic anemia? The megaloblastic anemia is due to the deficiency of vitamin B12 and folic acid. Okay. This is the megaloblastic anemia. And the next one, sickle cell anemia. The sickle cell anemia is a condition which is mostly inherited from the parents, inherited blood disorder. Okay. In which the sickle cells are developed in the blood. Okay. Sickle type of cells are developed in the blood. Next, what is thalassemia? The thalassemia is a condition in which less hemoglobin will be there. Okay. And hereditary acquired anemia. This is also one type of hematological disease. And what is hemophilia? Hemophilia is a blood clotting disorder in which the lacking of blood clotting proteins, okay, they are called clotting factors deficiency. Disease is called hemophilia. And the next one is endocrine system. The endocrine system is mostly involved with the hormones and endocrine glands. The first one is diabetes. Diabetes is a condition in which there will be a excessive or low levels of sugars in the body. Next, thyroid disease. The thyroid disease is mostly one of the endocrine disease which is mostly the deficiency of T3 and T4 levels in the body. Okay. Disorders of sex hormone. What are the disorders which leads to the deficiency of the sex hormones? Next, nervous system. The diseases which will be occur in the nervous system. First one, epilepsy and Parkinson's disease, stroke, psychiatric disorders, depression, schizophrenia and Alzheimer's disease. Okay. These are the diseases related to the nervous system. First of all, diabetes, a group of diseases that results in the too much of sugars. Okay. Next, epilepsy. Epilepsy is a condition in which the brain is shaking. Okay. Not in epilepsy, but in Parkinson's disease, the progressive nervous system is disorder. Okay. In epilepsy, excessive electrical activity, okay, electrical activity in the brains. Next, in Parkinson's disease, there is a progressive degeneration of the neurons, okay. Next, the stroke is occur due to the formation of anything in the brain. Next, depression. The depression is a mood disorder that causes the feeling of sadness, okay. Next, schizophrenia. It is a mental disorder in which the loss of consciousness or the emotional response or the social interactions. What is Alzheimer's disease? The Alzheimer's disease is a condition in which there will be a loss of memory or the destroy of the memory. It is a type of brain disorder. Next, what is a gastrointestinal system? The gastrointestinal system, which is mostly related with the gastric diseases like peptic ulcer. What are peptic ulcer? Peptic ulcer are an open sore that is lining in the stomach or in the duodenum, okay. This is about the unit 3, the topics to be covered in the unit 3, okay. And the next, unit 4. The unit 4, the first one is the inflammatory bowel diseases. What are the inflammatory bowel diseases? The inflammatory bowel diseases are the group of diseases that can cause the inflammation to the digestive tract, okay. They are called the inflammation to the digestive tract. And what is jaundice and what is hepatitis, and how many types of hepatitis are there? Hepatitis A, hepatitis B, hepatitis C, and hepatitis D, along with hepatitis E and F, okay. Next, alcohol liver disease. The alcoholic liver diseases are mostly preventable diseases in which they are mostly the liver is damaged due to the excessive alcoholic consumption. And what are the diseases of bones and joints? The following are the diseases of bones and joints are rheumatoid arthritis, osteoporosis, and gout. What is the rheumatoid arthritis? The rheumatoid arthritis is a chronic autoimmune disorder in which the joints may be affected, okay na? What is osteoporosis? The osteoporosis is a bone disease which is occur when the body loses to the too much of the bone, okay. Next, gout. Gout is an autoimmune disease in which the type of arthritis, okay, the degeneration of the bone tissues. Next, principle of cancer. What is a principle involved in the cancer? The cancer is a type of disease in which it is a chronic disorder in the irregular or the continuous growth of the cells will be occur. Classification of cancer. How many types of cancer? That is a carcinoma, sarcoma, leukemia, lymphoma, and myeloma. These are the different types of cancer. What is the etiology and pathogenesis of cancer to be discussed in the unit 4. These are the topics to be covered under the unit 4. Next, unit 5. The topics in the unit 5 are: first one, infectious diseases. How many types of infectious diseases are there and what are they and how they will be treated, okay. First of all, meningitis. The word meningitis is mostly related with the brain and an infection and swelling in the fluids, okay. Fluids in the brain is called as a meningitis. Next, typhoid. Typhoid is a type of infectious disease which is mostly caused due to the typhoid bacteria, okay. What is leprosy? Leprosy is also an infectious viral disease and which is caused due to the Mycobacterium leprae. And tuberculosis. Tuberculosis is also one of the infectious disease in which the lungs are mostly affected. Urinary tract infections. The infections which are occur to the urinary system are called as a urinary tract infections, and they are mostly occurs the urinary parts, okay. Next, SAR virus including COVID-19, okay. Next, conjunctivitis. The conjunctivitis is the inflammation to the conjunctiva, means eye part. The conjunctivitis is also called as a pink eye disease. What is measles? Measles is an high contagious disease, viral disease, which is spreads through the air from one person to the another person by cough or sneezing. Okay, and the sexually transmitted diseases like AIDS, syphilis, and gonorrhea. And what is AIDS? The AIDS is a acquired immunodeficiency syndrome. Okay, it is a viral infection. And the next, syphilis. Syphilis is a cause due to the Treponema palladium, whereas gonorrhea may be caused due to the Neisseria gonorrhea, a type of viral disease. Okay, and the AIDS is a chronic condition. These three diseases, the immune system will be damaged. Okay, this is about the unit 5 topics to be covered. So that's all for this session. Thank you, and please do subscribe Pharma Icon.